Muscle spasm is the painful contraction of your skeletal muscle. They may be due to many reasons. Weakness and dehydration can cause muscle spasms. Most of the time, stress and overuse of muscle may also lead to this condition. They are often associated with muscle stiffness and difficulty in movement. Muscle spasms can be relieved by taking rest and drinking plenty of fluids. However, a few muscle spasms are severe and painful and are not relieved by physical therapy. In such situations, you may be given a few medications called muscle relaxants. Few of them act peripherally at skeletal muscle, but a few others act on your brain to relieve muscle spasm. Cyclobenzaprine is such a medication that acts on your brain to control muscle contraction. Therefore, it is classified as a centrally acting muscle relaxant. Since cyclobenzaprine is centrally acting, it is more efficient at relieving muscle spasm than local agents. However, it is associated with a few central effects. In this video, let's explore such key facts about cyclobenzaprine. Where is it used? Cyclobenzaprine can be given to you to relieve symptoms of muscle spasm. It is used for a short period of up to 2 to 3 weeks. It can relieve muscle stiffness and immobility. This can help relieve pain in muscles. However, this medication is not suitable for muscle spasms produced by either damage or defect in a few neurons in your brain and spinal cord. Cerebral palsy is a spastic condition observed in children due to defects in brain development. Such disorders are not treated by cyclobenzaprine. How to take this medication? You can get cyclobenzaprine as tablets intended for immediate release of medication. Each tablet contains cyclobenzaprine as its salt hydrochloride. They are available in 3 strengths: 5 milligrams, 7.5 milligrams, and 10 milligrams. You can also get this medication in capsules. However, they are not immediate release formulations. They are intended for slow release of medication for a longer time. Therefore, they are not equivalent to tablets. You can clearly observe that these extended release capsules contain a higher amount of medication than immediate release tablets. These capsules are available in 2 strengths, 15 milligrams and 30 milligrams. The dose of cyclobenzaprine depends on many factors, like your age, dosage form, and liver function. For the treatment of muscle spasm, cyclobenzaprine is typically given at a dose of 15 milligrams per day initially. It can be prescribed in 2 ways. You may be given 5 milligrams immediate release tablets 3 times a day. Otherwise, you may be given 15 milligrams extended release capsules once a day. It is always better to take extended release capsules at the same time each day for constant release of medication for all days of treatment. The liver is the main organ that clears the medication from your body through its metabolism. In people with liver impairment, medication released from extended release capsules is not properly metabolized, leading to a buildup of dose in the body. Therefore, for such people, the use of extended release capsules is not recommended. However, immediate release tablets can be given to such people. If you are able, you can take the capsule as a whole. Otherwise, the capsule may be opened, and the granules may be sprinkled on a tablespoon of applesauce. It should be swallowed immediately and shouldn't be chewed. Rinse your mouth with water to ensure no content remains in your mouth. Your doctor can also increase the dose of cyclobenzaprine based on a requirement. It can also be given 30 milligrams per day in divided doses. For example, you may be given 10 milligrams tablets 3 times a day or a 30 milligrams extended release capsule once a day. You should use cyclobenzaprine for shorter periods. Use of this medication is recommended up to 2 to 3 weeks. The side effects of cyclobenzaprine are more pronounced in the elders. They may have more dizziness, confusion, and blurred vision. Therefore, a low dose of cyclobenzaprine should be used among them. Dosing frequency can also be reduced to minimize side effects. Your doctor will adjust the dose and frequency based on your response to this medication. How it works? Cyclobenzaprine modifies signals from your brain that control muscle contraction. Normally, your muscles undergo contraction due to the release of a chemical mediator called acetylcholine. This mediator directly acts on the muscle to increase calcium entry and subsequent contraction. However, cyclobenzaprine is not acting at this level. It acts centrally on a few neurons that release acetylcholine. These neurons are called motor neurons. Cyclobenzaprine inhibits the firing of these motor neurons in your brain and spinal cord. Due to this inhibition, acetylcholine is less released. This prevents contraction and relieves muscle spasm. Serotonin syndrome. Cyclobenzaprine elevates the levels of serotonin in your brain. This helps in relieving muscle spasm. However, excessive elevation of serotonin in your blood can cause serious effects. You may have increased nervousness, agitation, and tremors. You can also have hallucinations that lead to abnormal perceptions. You may have excessive sweating and an increased heart rate. These side effects are not observed when cyclobenzaprine is used at a normal dose. However, when it is combined with other medications that elevate serotonin levels in your brain, it can precipitate this syndrome. A number of medications used for treating depression can elevate serotonin levels. Selective serotonin reuptake inhibitors like fluvoxamine, fluoxetine, and paroxetine, and selective norepinephrine reuptake inhibitors like venlafaxine and duloxetine are few examples. All such medications should be carefully used with cyclobenzaprine. TCAs are tricyclic antidepressants that also elevate serotonin. Cyclobenzaprine is originally a medication related to TCAs. Therefore, it produces a few actions and side effects like them. That's why it should never be combined with TCAs. Urinary retention. If you have any previous history of urinary problems, use this medication cautiously. Cyclobenzaprine can increase the risk of urinary retention. So be cautious when it is combined with other medications that retain urine. Generally, a few medications like antihistamines and centrally acting drugs show anticholinergic actions. Such medications can cause urinary retention that is more pronounced when they are used with cyclobenzaprine. It can also elevate pressure in your eye in such combinations. Cardiac arrhythmias. Use of cyclobenzaprine may have a few effects on the heart. It can increase your heart rate. However, these effects are more pronounced at higher doses. Therefore, observe any symptoms like palpitations and discomfort in the chest. You should be more cautious if you have any risk factors like elevated blood pressure and cholesterol levels. Drowsiness. Like many centrally acting medications, cyclobenzaprine can also induce drowsiness in people. You may have lightheadedness and sleepiness. These effects are more troublesome for the elders. Drowsiness may be gradually reduced during the course of therapy. Using opioid analgesics like tramadol may enhance the drowsiness produced by cyclobenzaprine. Effect on vision. Cyclobenzaprine may cause blurring of your vision. It is mild in many people. However, this medication can also increase intraocular pressure in the eye. So if you observe any eye pain and change vision, you should report with your doctor. Contraindications. Cyclobenzaprine can affect your heart. If you have any heart problems like cardiac arrhythmias, congestive heart failure, or heart block, the use of this medication is not recommended. If you're recovering from a recent myocardial infarction, you shouldn't use this medication. Avoid this medication if you observe any allergic reactions like skin rashes and swelling of your lips and tongue. If you have excessive thyroid activity, again, this medication is not recommended. What are the side effects? This medication can make you dizzy and drowsy. Drowsiness produced by this medication can be enhanced by other medications that depress CNS. Therefore, never combine other CNS depressants along with cyclobenzaprine. Alcohol can also enhance drowsiness produced by cyclobenzaprine. Therefore, avoid alcohol while taking this medication. It can produce a few other common side effects like dry mouth, tiredness, nausea, and indigestion. You may also have blurred vision and confusion. You can feel an unpleasant taste in your mouth. These side effects are mild and slowly disappear within a few days after starting therapy. However, if you observe serious side effects like rapid heartbeats, difficulty breathing, agitation, fainting, and vision changes, you may stop this medication and should report them with your doctor. That's all, guys. These are the important things that you should know about cyclobenzaprine. Thanks for watching this video. Have a great day.